February is Heart Month. With that being said, here are a couple of facts that should have you taking a second look at your heart. According to the Heart Foundation, heart disease is the #1 cause of death in the United States, killing nearly 790,000 people alone in 2011. That's 1 in every 4 deaths. Another shocking fact, cardiovascular diseases claim more lives than all forms of cancer combined. So this February, we wanted to give our hearts a little love and talk about ways to reduce heart disease. We spoke with Dr. Vijay Divakaran, Director of the Cardiac Catheterization Laboratory at Baylor Scott & White Health in Round Rock, Texas, about what heart disease is, some of the main symptoms, risk factors, and what you can do for prevention.
So heart disease is kind of a broad term that encompasses a lot of conditions. So if you look at the heart, there are coronary arteries that supply blood to the heart, and you could have a blockage in these arteries, and that's called as coronary artery disease. And that's the kind of disease that causes angina or chest pain and heart attacks. Sometimes you can have problems in the electrical system of the heart. And for example, atrial fibrillation is a condition that's caused by a problem in the electrical activity inside the heart. Sometimes you can have a weak heart muscle, and that's called as congestive heart failure. These are some of the broad categories of heart disease. There are many more specific diseases such as genetic diseases and other things that can affect the heart.
Now that we know some of the most broad forms of heart disease, what are some of the more common symptoms?
The vast majority of people experience chest pain or chest tightness as one of the common symptoms of heart disease, particularly coronary artery disease. But women can have atypical symptoms. So sometimes women can have symptoms such as shortness of breath, or sometimes you could feel like an indigestion or a fullness in the throat, or sometimes even jaw pain. So very often these symptoms manifest during exertion. So if somebody is fairly active and they're working out or walking or running and they start to have some chest pain or chest tightness, that's time to start getting concerned.
Dr. Divakaran told us some of the more common risk factors for heart disease are family history, high blood pressure, diabetes, and high cholesterol, as well as old age. He says the best way to fight against heart disease is prevention. You can do that by staying active, eating healthy, and in some cases, medication may be beneficial.
Prevention of heart disease is really to decrease the risk of a heart attack. And the most important thing in prevention, again, is diet and lifestyle. There are some things that you can modify, some things you cannot. You cannot change your age, you cannot change your genetic makeup. So if you talk about diet, a diet that is rich in fruits and vegetables and is low in saturated fats, cholesterol, and refined sugars is something that is very important to decrease the risk of heart disease.
As for lifestyle, the first thing you can do to improve not just heart health, but overall health as well, is to quit smoking if you currently do. The next big thing the American Heart Association recommends is to get rid of that sedentary lifestyle. A sedentary lifestyle has been linked to having years being taken off a person's life. For adults, 30 minutes a day, 5 days a week of physical activity is recommended. That doesn't mean you have to start pumping iron. It's as simple as taking a walk or bike ride, just as long as you get moving. Along with diet and lifestyle, some doctors may prescribe medications to help lower certain risk factors.
A low-dose aspirin is recommended in patients that have a strong risk for heart disease. Sometimes your physician may also recommend taking a medicine called as a statin. A statin is a medicine that lowers cholesterol, particularly the bad form of cholesterol that causes cholesterol deposits in the coronary arteries.
Remember, heart disease is the #1 cause of death in the United States. But you can help reduce that by being active, eating healthy, and talking to your doctor about early warning signs to look out for. So protect your heart this February. For RX Wiki, I'm Gabe Garza.